to a topic that everybody's buzzing about. You know, treating breast cancer almost always involves some sort of surgery, and for years the choice was just having the lump or maybe the whole entire breast removed. Well, since Angelina Jolie announced that she got that double mastectomy, everybody's talking about the procedure. There are alternatives to getting a mastectomy. Joining us this morning once again, Dr. Eva Lean from Tri-City Medical Center, as well as AGATA SLIWOWSKI. She is a breast cancer patient. Good morning to both of you, and thank you so much for staying with us.
Good.
AGATA, we wanted to have you back on because your story is so touching, and I personally think it's incredibly brave of you to share what you're going through. Take us back to the day you first found out that you had breast cancer.
It was January when I went to see my doctor. They called me and they said they had results, and I was told that I have breast cancer, a very invasive, very aggressive form of cancer. That was January 2012.
Okay, and since then you've undergone a double mastectomy, which was, I'm assuming, an incredibly difficult decision.
It was, but I think it was the best decision I could make for myself and for my family, for my husband, and I'm very happy with my decision right now.
So, Doctor, patients like AGATA and Angelina Jolie choose to do the mastectomy. Why?
Well, a little bit different situation in the sense that in Ms. Jolie's case, this was purely a prophylactic, preemptive, if you will, movement, in the sense that she had a risk factor that she was aware of that put her somewhere in up to a 7% range of risk for lifetime occurrence of breast cancer. In order to deal with that decision, she could choose one of the options of trying to go on a heightened surveillance with mammograms done on a yearly basis, with MRIs done on a yearly basis, with frequent exams, and that would be one of her options, but that's for breast cancer.
Right.
However, there is also the issue of ovarian cancer.
Okay.
And for that, we recommend that women have the pelvic exams every 6 months with transvaginal ultrasound, and there's also a blood test called CA-125, which can help us determine if there is some abnormality brewing. So that's one option. Okay.
And so if you are someone that has, say, a family history like AGATA, like Angelina Jolie, if you get these mammograms, if you do these tests, I mean, once the cancer has taken hold of you, is it too late by then to stop it? Whereas a mastectomy reduces the chance greatly.
Well, mastectomy in a preemptive strike, if you will, will reduce your risk of having ever to deal with the breast cancer by a factor of up to 90 plus 97%. So that is the motivation which leads a lot of women who are carriers of the gene to choose that option, which is a very valid option and should be certainly considered. And we do have very strong discussion with patients or women who have that particular situation. Then there's also issue about doing the oophorectomy, which is removal of the ovaries. So those are the purely preemptive. On the other hand, if you choose not to do that, and you go into the surveillance, if you will, group, then if we were to have a diagnosis of breast cancer, the idea is or breast ovarian cancer, we'll detect it so early that will be able to offer a curative, highly effective treatment for the breast cancer as it occurs.
Okay. Now, AGATA, have you ever for a moment regretted your decision to have the double mastectomy?
Not yet.
No.
And I'm not expecting it to happen. I think it's my decision was based on fear of having cancer again, and this is something that I don't want to have. I don't want to deal with it. I want to deal with it now and have it done and never come back. So that's my my motivation behind, and I don't regret my decision.
And how are you doing now?
I'm doing fine. I still have some chemo treatments to go through, but I'm also looking through to reconstruction, which is another option, and this is actually great that we have this option, because maybe this decision would not be so easy if it wasn't for the reconstruction and the fantastic options that we have nowadays.
That's a great point.
It is.
Ladies, thank you so much for joining us, for sharing your story and your expertise, and AGATA, we wish you the very best.
Thank you so much.
All right.
Thank you.
To many, many years of health. Coming up on Good Morning Sam.